So from your symptoms is when you can be able to explain to your doctor and he'll be able to tell you what to do. Either you need a flu test or you need a COVID test, or you just need a test, or you just need medication. So welcome so much to my YouTube channel. My name is Yeti at Nashville, and I do videos to do with healthcare, lifestyle, and just what's up in the health world. And so today is the 14th day of my COVID, symptomatic COVID, and I am currently remaining with only three symptoms, which is fatigue, a productive cough, and abdominal discomfort and diarrhea. And that is where we come to our discussion for the day. This is the GI symptoms. Are some of they are not even in the list of the above 5 symptoms by the Zoe symptomatic chart. So it is sort of always left out, and that is what I left out. When I came here, it was day 6 of my exposure, and that is when I was symptomatic. But now, day 4 of my exposure, I started having butterflies in my tummies. I was having nausea, and I didn't have appetite at all. And I was feeling like air is trapped in my tummy, and I really need to pass gas or just diarrhea and get over it. But it didn't come up until day 3 post symptoms, which is now day 7 of exposure. That is when I started having diarrhea. So somebody might ask, why should I have a GI symptom? GI is gastrointestinal symptom, and our gastrointestinal system starts from your mouth to the stomach to the anal opening, and our our respiratory system starts from the nose all the way to the trachea, to the lung system, and that is where it ends. So somebody might ask, why should I have such symptoms? And I have a respiratory infection. So we have a junction where the gastrointestinal system and the respiratory system meets, and that is the oropharyngeal area. So this nasal cavity is the nasopharyngeal region that goes all the way and meets at the throat, which is the oropharyngeal area, and then the mouth starts from here, the oral cavity, and it goes here to the oropharyngeal region, and then from here is where they separate. Gastric system goes to the hypopharyngeal area and goes down and meets the esophagus. And then on the front part here, we have the laryngeal area where the voice box is also there, and then from the laryngeal area you go to the trachea, and now the trachea goes down and branches into the right or the left bronchioles, and then goes into the lung system. So that is how that is how they're aligned. And now here the larynx and the esophagus here, the trachea and the esophagus down here are separated by the tracheal muscle. So, and up here they are separated by the epiglottis. So this epiglottis is the one that controls the closing of the trachea, so that the laryngeal area, so that you don't choke. Now, when here at the oropharyngeal region, when you pull back your sputum, it goes back and now passes down here. Okay, so there's a very high likelihood that you might swallow sputum that goes into the GI system, your stomach, and the gastric acids cannot kill these viruses apparently, and then it goes down. When they test the stool, sometimes they can find the virus into in the stool. So now that is how you come about to get the gastrointestinal signs when you're having COVID. And apparently 70 to 75% of people who have COVID, they have also the gastrointestinal system symptoms. And what you just have to look up for is if the symptoms become more, and if the diarrhea is a lot and you're getting dehydrated, that is the time you can go to see the doctor because of the diarrhea. But in most of the cases, it is just mild gastrointestinal system. And if you have severe abdominal pain and you're sure it is from inside the stomach and it's not the muscles from coughing, then you can also go and see a physician, go to the hospital and get checked. You might be coming down with either liver issues or kidney issues, so you need to have yourself checked with severe abdominal symptoms. Yeah, that's all about today, and I just thought I should come out and share because many people, it's a symptom that has been neglected, but it is out here and people are experiencing. So if you have it, just know that it's part of the whole COVID system, and it shall be well. And I wish you all the best in your treatment. If you have COVID or any flu, get tested to rule out the COVID so that you know how to take care of yourself. It is bye from me, and I am so glad that we rejoined together. To my old subscribers, thank you very much. My new subscribers, karibuni sana. And it's bye from me. See you next time.